This is an area that I'm fairly active in, and just wanted to clarify some things. You had said that they are quite effective as pain managing agents. Can you expand on that? I mean,
Sure.
my impression is...
Yeah, let me be clear what I mean by
Yeah.
this. For acute pain, they are unrivaled. I mean, they
Yes.
go back historically for burn pain, for blunt trauma pain, and so forth. Having said that, you bring up a good point. What has become clear recently is that for chronic pain,
Yes.
low back pain, that's a bad indication, but that's something that has emerged over the last 10 or so years.
Well,
Did you see that being curtailed?
even with months, I mean, there's a large meta-analysis by Busi, which was published in JAMA, which found little effectiveness above placebo for chronic pain and no effectiveness compared to non-steroidal anti-inflammatory agents. And they just, if you look at the studies they were basing on, they were just studies that were following patients for months, not years. The data for years just isn't there. I mean, why would you do a year study when you're getting harm at months? And yet they were approved by the FDA, and that's the basis of a lot of the lawsuits. So one of my concerns is, and this has to do with the bundle that Medicaid was using, that there was an opioid checkbox error. It was monitoring chronic pain for opioid usage above a certain level. From what I'm seeing from the current research is that this actually be making chronic pain worse in patients, and you can't predict who will do what, that maybe we should just be looking at it's being used in chronic pain and not worried about the level in chronic pain, because that gives, to me, an implication that there is a safe level. I think these are very high-risk medications, and this is how we got in this mess in the first place, and we need to just call a spade a spade. And I realize that a lot of this information is contained in the lawsuits, investigative reports, this large meta-analysis that it's just coming out now, but it's really caused a paradigm shift in the way I think a lot of people are thinking about this problem, and whether or not the committee is thinking is reflecting this change, and whether or not the opioid pamphlet, which was written by NQF several months or year ago or whatever, can be updated to reflect this information.
Yeah, I agree very much. And so just to clarify, so to make sure I get it, Busi, you said was the
that was Busi, B-U-S-S-E, J-W. It was in JAMA, December 18th, 2018. A very large meta-analysis of the chronic studies, followed by a very poignant editorial, and that was by Ashburn and Flesher, also published in JAMA. And then that was then followed by these lawsuits, which were then filed by the states, of which there's just incredible amount of information in there. Now, granted, it's a lay literature, not peer-reviewed, but after reading all this, how do you trust the peer-reviewed literature in this area? Because the amount of money, conflicts of interest, et cetera, is just abhorrent.